Namaste, welcome back to my channel. Today let us have a discussion on laboratory audit points, in the sense NABH audit points. During audit, what and all they are going to expect in a lab, that I am going to explain you in this video, and also in upcoming videos I am plan to each department wise audit points I am going to discuss with you all people. So today let us have a discussion on laboratory audit points. The first point in the laboratory is SOPs. So based on SOP, like standard operating procedure, based on this our daily activities will be performed. So there is a standard operating procedure for each activities. So the lab should have a SOPs for each activities. Second point is a written document on scope of laboratory services shall be available. So there should be a written documents on scope of services in a laboratory, and this is basically a list of tests that can be done in the laboratory. So what and all they are going to perform in the laboratory, that list to be documented, and same thing should be displayed also. And this scope of services, basically it is depend upon what kind of services are given by the hospital. So based on the hospital scope of services, even the lab also should have a scope of services, and the list should be updated from time to time. The scope of services like in-house and outsource, it should be displayed in front of the laboratory, and it should be in a bilingual. Whichever test we are not going to conduct in our lab, we should have a external lab. So we should have a MOU with the other lab. In case some test cannot be offered or is not available, an arrangement should be there to outsource such tests to an external laboratory. In this case, following things are required to be ensured. So first thing, we should prepare the list of outsourced tests and specify to the lab. In each of the external lab, identify of the coordinating personnel from the lab should be available in written. So in a MOU, with whom we should discuss, or who is a responsible person for our outsourced test. It should be written document in the MOU. Point number 4. A standard process should be there on how to outsource the test. So there is a SOP for outsourcing of a test. The standard process must describe the method of packaging of sample, labels and identification on packets, sending of other necessary information such as test requested and method of transportation of sample. So when we are outsourcing of any test, there is a standard SOP for outsourcing of a test, and method of packaging, labeling, identification and transporting of a test is very important. Point number 5. The selection of labs where the test will be outsourced should be based upon criteria of quality and safety. So whichever outsourced lab we are going to select, we should see the quality and safety of the laboratory. A policy of outsourcing only to NABL accredited lab can be adopted. However, not mandatory. The selection criteria should be available in written. So preferably we should go ahead with the NABL accredited lab so that we can get accurate result. Point number 6. A written MOU should be signed with the outsourced lab specifying the terms and conditions related to quality assurance requirements. And the documents are, first and foremost thing, for a outsourcing of a test, we should have a SOPs, and we should have a written documentation like MOU, lab requisition and register, outsource register and critical result register. Point number 7. there should be a defined turnaround time for each test should be available in written. So we should have in a SOP about turnaround time for each test, and same thing should be displayed and same thing has to be followed. Point number 8, a list of tests for which informed consent is required, like example HIV test, should be prepared. So we should have a informed consent for the certain test, like example HIV. A documented process on handling of critical findings should be available. The document should list out those findings that should be considered as critical and step by step process on what should be done once a critical. So in a laboratory, if there is any critical result, we should have a proper SOP for how to process the critical result. And the list of critical results should be displayed, and also the laboratory staff, those who are working in a lab, they should be well versed with the critical values and the process of critical result intimation policy. And also there is a evidence like a critical result intimation register should be available in the lab. Point number 9, what is internal and external quality control in laboratory? So we should have a internal QCs and external QCs in our lab, again to get a accuracy in the lab test. In that case, internal quality control monitors the daily precision and accuracy of methodologies, personnel and instruments. External quality control maintains long-term accuracy. External quality assurance should be done. Samples of specimens must be sent to an external lab for testing and finding must be correlated. Point number 10, minutes of meeting should be available to show that external and internal quality assurance findings have been communicated, discussed, analyzed and action has been taken. And also in a lab, each equipment in laboratory should have a calibration schedule. So in a lab, all equipments whatever it is present in a lab, it has to undergo for a calibration, periodic calibration, and also same thing should be documented, and also the label should be reflect on the equipments. The calibration report has to be filed in the calibration file. Point number 11, in a laboratory, each equipment should have a preventive maintenance schedule. This can be documented in the equipment log. A record of preventive maintenance check carried out should be available. A register documenting all corrective and preventive action taken should be available. So there should be a preventive maintenance checklist and documentation must be evidenced in the laboratory. Point number 12, following laboratory safety measures should be in a place. A laboratory safety manual that describes all safety practices to be followed by staff during work should be available. So it is very important in a laboratory. Those who are working in a lab, there is a maximum exposure to the infections. In that case, they should have certain policy procedure on infection control practices, maximum safety procedure they should follow, using of personal protective equipments and handling of infectious waste. All laboratory staff has to be trained on infection control practices as well as lab safety practices. They should aware on usage of personal protective equipments and handling of biomedical waste and spill management, needle stick injury management. Point number 13, personal protective gear such as apron, gowns, gloves, eye covers, etc. should be available. Types of gear should be according to the risk to which staff is exposed to while conducting test. So maximum availability of personal protective equipments in the lab is very important, and also staff should be well versed with usage of PPEs. Point number 14. A list of all hazardous chemicals being used and stored in laboratory should be prepared, and MSDS for each hazardous items must be available. In a lab, what and all they are using a chemicals, they should have a list of hazardous material, and also they are supposed to have MSDS checklist, and storage of all chemical, it should be below the chest level. Maximum safety has to be taken again to prevent hazardous exposure to the laboratory staff. Hazardous chemicals should be stored safely to prevent its accidental spillage. A spill management protocol including blood spill must be in place, and things required for cleaning spill should be available. So in a laboratory, must and should we should have a spill kits. So to manage again blood and body fluid spill or hazardous spill. I have already made a video on spill management. Please go through with that video. And point number 15. A written guidelines should be available for disposal of infectious biomedical waste. Again, regarding biomedical waste management also, I have already uploaded 3 videos, one in Kannada and 2 are in English. Please go through with that policy. Point number 16. A representative from laboratory should be the member of hospital safety committee. You can refer safety committee under the list of hospital committees and terms. Each staff should have been trained and aware of laboratory safety practices. Records of training and evaluation to be maintained. So all staff must undergo for a training on safety practices, and training evidence should be available in the lab. Point number 17. The staff should be aware of other topics which includes patient rights and responsibility, employee rights and responsibility, scope of services of hospital and laboratory, critical findings and what to do in those situations, occupational health hazard that they are exposed to, and how to prevent, basic life support and code blue procedure, other emergency codes used in hospitals such as code red, code pink, etc., standard precautions for infection prevention, emergency evacuation plan, dealing with HIV positive patient and maintaining confidentiality, turnaround time and other quality indicator being used in laboratory. And also the staff should be aware on quality indicator which is performed in a laboratory. Lab quality indicators are percentage of complaints to laboratory safety practices done through sample monitoring, and percentage of critical result reported to concerned consultant within the given time frame, and the percentage of retesting done. So these are all the important quality indicator has to be maintained in the lab. So this is regarding lab NABH entry level audit points. In next video I am going to upload imaging services audit points. Thank you.